All right, good afternoon, and thank you for joining today. We will get started because we have a lot of content to cover. My name is Grace Kading. I am a project manager on the CRISP Reporting Services team, and today I'll be giving over a high-level overview and intro to the Multi-Payer Reporting Suite Multi-Payer Reporting Suite. I will then hand it off to Audrey Speeder from hMetrix, and she will be providing an in-depth overview of the reports and a demo of the reports. Some housekeeping items I wanted to go through. The webinar is being recorded. We will send out the recording and the slide deck after. All audio lines are also muted. If you have any questions, please put them in the chat box and we will answer them. For any questions, please reference any reports or any reference material we need in order to answer the question. We will answer questions in the chat throughout the webinar and also at the end. And if we don't get to your question, we will always reach out to you and answer your question. Also, I wanted to note there will be a poll at the end to get your input on additional reports you would like to see added to the Multi-Payer Reporting Suite. Your feedback is important to us, and this is a great opportunity to share what would be useful to add to the Multi-Payer Reporting Suite. So here's our agenda today. We'll go through some background on why the report is created, an overview of the data in the reports, accessing the suite, and a walkthrough, and then a live demo. And at the end, we'll answer some questions. So for some background, CRISP, in partnership with hMetrix, worked with Maryland Medicaid and the Maryland Primary Care Program, also known as MDPCP, to develop a report that combined Medicare and Medicaid claims data into a single reporting suite. And this was to support the alignment between MDPCP and Maryland Medicaid. And with this suite, we wanted users to be able to better understand trends in hospital utilization, facilitate care coordination, and monitor population health across their Medicare and Medicaid beneficiaries. So before we get into the reports and further into this, I wanted to go through a high-level overview of the data in the reports. And so right here I have a Venn diagram, and I want to focus on patients on organizations panels in the orange yellow right there. And so what is a panel? And some of you might be familiar with a panel, but a panel is basically a list of patients. And a panel can be submitted to CRISP, and it basically just tells CRISP that you have a treatment relationship with these patients. And so CRISP receives this panel. It's using other CRISP services. I will go through panels a little bit more in a couple minutes for any questions you might have. And then, so we look at this list of patients on your panel, and then we look at the Medicare fee-for-service, the Medicaid fee-for-service, and the Medicaid managed care data, and we see which beneficiaries on your panel fall into one of those categories. And this is what you'll see in the multi-payer reporting suite. So they have to be in both. And so if your patient's not enrolled in Medicare or Medicaid, they won't appear in this suite. And if a patient's not on your organization's panel, they won't be in this suite. So we just wanted to go through that just so you can get a better understanding. So this is just, this slide's a little bit repetitive, but just lists out the data that's in the report. So Medicare fee-for-service, Medicaid fee-for-service, and Medicaid managed care. And again, the suite only shows data for patients on your organization's panel that fall into one of those categories. And also the suite also only shows administrative claims data included in all care settings and services covered under Medicare and Medicaid. So again, it's all care settings and services covered under Medicare and Medicaid. And then the data displayed is only the last 36 months of data. This is a rolling 36 months. And there's about a 2-month data lag in the multi-payer reporting suite. And that's just another thing to note as you go through this report. So as mentioned before, I was going to give a high-level overview of panels just so in case users aren't aware, not familiar with panels, they'll get a better idea. So a panel, like I mentioned, is just a list of patients. You submit it to CRISP and establish a patient relationship between CRISP and your organization. And so who can upload a panel? Well, there's a variety of organizations that submit panels to CRISP, such as FQHCs, CTOs, ambulatory practice, and hospitals. So it varies who can upload a panel. And so how do I upload a panel? There's many paths, and different paths are might be more appropriate for your organization compared to others. And so I'm not going to list out all these paths for uploading a panel, but if you're interested in if you already have a panel or you want to create a panel or upload a panel, please contact support@crisphealth.org, and they will be able to direct you to the right person so you can better understand if you can upload a panel or even create a panel, or if you already have a panel with your organization. And one thing to highlight and note, organizations cannot upload a panel through CRISP Reporting Services portal or the multi-payer reporting suite. That is not one of the paths. So again, you'll need to reach out support@crisphealth.org if you're not sure. And so some of the fields that are required for uploading a panel is a patient ID, first name, last name, address, city, state, zip, date of birth, and gender. And you need those fields in order to upload a panel with CRISP. And as mentioned before, panels are used in multiple different CRISP services. And so this includes the multi-payer reporting suite. So again, you need a panel in order to use this report. And so accessing the reporting suite, you will go to reports.crisphealth.org. You'll be welcome to the CRISP Reporting Services portal homepage. And in the homepage, you'll see a box that has the all payer population card on it. And you'll click into there and the multi-payer reporting suite should pop up under the reports. If you do not have access to the report, or if you having trouble accessing it, please contact your organization's CRISP Reporting Services point of contact. If you don't know who that is, please contact report-support@crisphealth.org. This is the CRISP Reporting Services support email, and we will be able to get back to you and help you out with any issues you're having. So I will pass it off to Audrey Speeder.
Wonderful. Thank you, Grace. So before we jump into a full demonstration and the functionality of the reporting suite, I just want to walk you through the reports at a really high level. The first report you're going to come across is your population summary, which is really just a landing page, it's a dashboard to get you to everywhere else you want to go. We then have our population navigator, which is a beneficiary level view. There's a lot of functionality and a lot of customization that can happen here that I'll walk you through in a little bit. And then we get into our utilization reports. The first is our measure comparison by time period, which takes several different reports, shows the utilization across the metrics in one view. And you can get the individual utilization through the next 5. So your acute care setting, emergency room, plan all-cause readmission, PQI, and follow-up are all metrics that are consolidated within your measure comparison report. We then look into PMPM trends, where we're looking at payments across all care settings, and then have 3 separate dashboards that are very topic specific. We're looking at health equity across utilization patterns. We have a suite specific to maternal health, and then we have select CMS core set measures with individual dashboards for select measures. So with that, I'm now going to take over and walk you through our reports. Grace, can you confirm that you can see my screen?
Yes, we can see your screen, Audrey.
Wonderful. Okay, so this is the reporting suite that you will see as soon as you log in with the steps that Grace provided you with. And this is the population summary that I mentioned, which is really just a landing page that's going to get you to all of the other reports. You'll notice there's a widget for each report with a pertinent piece of information just to help you understand kind of where you are with your utilization. So you'll see we have number of admissions, you have ER visits, you have readmission rate, and other just quick metrics for you to take a look at across all of the reports. Before we get into those details, I want to acquaint you with the reports overall. You have this top panel, which is your global filters. These global filters are going to apply to every report within the reporting suite. So it's a way for you to select your population, even subset your population, and apply that across the entire report. So the first is your panel view. If you have multiple panels that you have access to, you would use this dropdown to select the one you want to use. You can only use one panel at a time. We then have a roster dropdown, which I'm going to talk you through in more detail in just a few minutes, but this is a custom list of beneficiaries within your panel that you have personally pulled out. It's your personal subpopulation that you want to focus on. From there, you have your panel, you have your roster, and then you have an additional functionality where you can subset that by your Medicare patients, your Medicaid patients, or your full panel overall. As Grace introduced, we only have Medicare and Medicaid claims in the reporting suite at this time, and this little eye indicator helps you understand who you're looking at and who you're not looking at. So the panel number 4 that I'm going to share with you today, we have 22,039 beneficiaries in total that are viewable in this report. We have 8,500 on Medicare, 15,000 or so in Medicaid, and I have a large number of beneficiaries that are neither Medicare or Medicaid, they're commercial, they're not included in here. So what you can do using this filter is say that I want to only focus on my Medicare population. And when you apply that filter, I think we had 8,552, you'll see that the beneficiary count for all of the reports will be limited to that 8,552 patients. All my Medicaid, all my other are not going to be populated. So it's one way to kind of further customize the panel within the reporting suite so you don't need to generate a new panel with CRISP. I'm going to go ahead and go back to my all population. And now let's get into some functionality. So the first thing I want to show you is our population navigator. I navigated to it from my left menu. You also could have used that beneficiary count widget that was in the middle of the screen. And this is beneficiary level information for everybody in my panel that met the criteria of my global filter. And you can see your control total of 22,039 patients. They're all represented here. This provides clinical and demographic characteristic about your patients. So you have a series of columns that's going to tell you all about their demographics that we have. We have indicators for Medicaid and Medicare. We also have Medicaid plan information, other demographics. We also have some utilization characteristics. So their number of IP admissions, ER admissions, PQIs, et cetera, as well as yes, no flags for a variety of chronic conditions. These are using the CMS chronic condition warehouse flags. That is a beneficiary level flag to indicate if that beneficiary has a history of any of these conditions. This is fully customizable. You're able to turn on and off any of these columns. You're also able to click and drag so that you can make this view work the best for you. You can also filter. If I wanted to do a filter here of only my Medicaid, I could do yes or no and get rid of or hide those other patients. Once you get a list that you're comfortable with, you're able to export this to Excel. When you can do a basic export, which is only the view that you see right now, or you can do a detailed export that has every data element that we have that you may not be showing. So it'll have all the chronic conditions, it'll have all the claim, all of the column elements. That'll pop up into Excel. You'll get a report like this. You can save it, use it internally. Please be mindful, this will contain PHI. You get a pop-up to just highlight you will be downloading PHI and to please use it appropriately. Oh, I guess I should actually comment. It was on the slides from Grace, but everything you're seeing here is fictitious. There is no PHI contained in this demo suite. All of this data is made up. You might notice some odd names. That's due to the masking of our data to protect all PHI. Okay, so one other fun functionality in our population navigator is our measure bar on the right. And this is the ability to further customize your list to a population of interest. So for example, these are all chronic conditions, and you can either select people with that chronic condition or select people without that chronic condition. And the count gives you a sense of how many beneficiaries meet that criteria. So even without clicking anything, I'm able to see I have about 4,000 beneficiaries that have a history of depression, 7,200 with hyperlipidemia, etc. I want to actually apply some of these filters. So I'm going to first look for the population that has diabetes, that 3,700. And I also want to look for the population that also has hypertension. So for my care management purposes within my organization, I want my Medicare and Medicaid beneficiaries that have both a history of diabetes and a history of depression. I have identified 3,184 beneficiaries, and I want to start looking at the utilization for those patients. So using Population Navigator, you're going to see this roster button on the top, and you're going to see a Create button. So I'm going to be creating a roster for my population that has diabetes, and hypertension. And I'm going to go ahead and give this a date. And this is just any name that can work for you that you will identify what your population is. And I'm going to make sure that it is being created from my current view. When I click Create Roster, when I click Create Roster, it's going to give me an opportunity to review my list. It's going to say, are you sure you want all of these people? There is a chance here that you can remove any individual beneficiaries you don't want. You could actually add others if you search by name. Once I'm okay with it, I'm going to go ahead and click Accept, and it'll create the roster for me. I've actually gone ahead and created this roster for us already. You'll see that I have my diabetes hypertension roster with 0116 for today's date, and we can go ahead and start applying that. So let's see. One other way you can create a roster is by an upload function. So if you have a list of patients that you know you want to create a roster from and you don't want to do it organically in the reporting suite, you can download a download template. This template only requires 4 pieces of information. You need the patient's last name, the patient's first name, their gender, and their date of birth. Once you upload that, it will then identify the patients. It'll give you the same walkthrough that I just showed you. It'll ask you to review and accept, and it'll create that roster for you. So you have multiple ways to create rosters within the reporting suite to get really the customized experience. Last but not least, I'm just going to highlight this quickly, and there's a lot more details in the user guide, is you can combine multiple rosters using set operators. So if you have 2 rosters that you want to find the overlap of those 2 where they intersect, or if you want to just put them both together and combine them into one, you can use this using the module here. All right, so let's go ahead and look into the reports. The first thing I'm going to pull up is our measure comparison by time period. And I am going to apply my new roster of my diabetes and hypertension patients. We're going to give this a second to refresh. And as I mentioned at the beginning, this report is taking several metrics across all of the reports and giving you a really high-level view of it. This is the only report that uses one year of data and gives you a year-over-year change in the utilization. So we have these metrics. We're looking at inpatient admissions, ER, NED, et cetera. We're looking at the utilization from September 2022 to September 2023 and highlighting the variance in those metrics. We're looking at our panel, which is mine's panel number 4, and I'm comparing it to the Medicare population. I can also switch this to look at the Medicaid population, or if I wanted to highlight my panel to only be Medicare, I could highlight my Medicare here, apply that, and I would have a real apples to apples in the population I'm looking at. This is giving just the trend lines where the blue line is your panel, the orange line is your comparison group, and you'll see that those colors persist across the entire reporting suite. So that's going to be your cue when you start seeing orange that you're looking at a comparison. When you see blue, you're looking at your panel. And it's a quick way to just notice if there's any correlation in your utilization across metrics for the population. This is a high-level report. It does not contain the drill-throughs, but if you want to start looking to investigate what's causing those trends, we can jump into our utilization reports. And the first one I'm going to show you is acute care setting utilization. This report is focusing on your acute care hospital admissions as well as readmissions. I'm actually going to turn off my roster for this so I can get some higher utilization to show us some trends. I just toggled back to my default, which is going to show me my full population of 22,000. So in the acute care setting, actually all of the reports that follow are going to have the same top filters. There's going to be a sliding bar that's going to highlight your date range. This is going to show you which claim period you're looking at. You'll see that all of the reports are defaulted to a certain date, but you can extend them past that date. This date is selected based on claim completion. So if I go ahead and I want to look at, in this demo suite, August 2023, I'm going to get an indicator that says that these claims are not considered complete. That's really important when you're looking at rated analyses or when you're looking at trends over time. Just due to claim processing within Medicare and Medicaid, we assume that it takes 3 months to consider a claim complete, to make sure that we're getting the full utilization. So please heed this warning. If you're looking at trended analysis, you want to make sure you're using a period prior to that lag. You also have a comparison group where you can look at Medicare or Medicaid. Now in this report, we have a top panel and a bottom panel that are actually mirrored. Your top panel is looking at your individual panel. You're looking at inpatient admissions and you're looking at readmissions as the lighter line as counts. And on the right side, you're looking at the payments for those events. The bottom panel right below it is the exact same metrics, but it's focusing on the Medicare population because that is the comparison group that I selected for counts and for payments. So you can look at how those two trend together and what those differences are. We then at the bottom have more details where we're looking at total inpatient admissions or readmissions. And we're looking at, we actually have an indicator to identify if they are PQI, if they are avoidable, or if they are non-PQI, being non-avoidable events. So we're looking at the distribution of those hospitalizations. I'm focused on inpatient hospitalizations right now. Hospital inpatient admissions by the hospital name. You can also look at it by primary diagnosis. And then based on those selections, you can see the details by individual patient. So look at beneficiary level information with their length of stay, their admissions and their readmissions, and then utilization at a hospital level. All of these reports are dynamic and they update together. So if I wanted to look at, for example, my septic population, I would be able to select on my sepsis. It will update all of the charts to only show me my 241 patients that had an admission with a primary diagnosis of sepsis. So everything has updated. I now have my beneficiaries. I have my beneficiaries in my hospitals for my sepsis admissions. You're also able to get the beneficiary details for those admissions. So there's 241 events or admissions. But we'll see when we look into beneficiary details, that's associated with 229 patients or beneficiaries. You're able to now see all of the beneficiaries that had those admissions. And if I wanted to click into any individual beneficiary, I could see their specific claims for the duration of the claim period we have available. It's not specific to sepsis, it's all of their claim history. And this can certainly be exported into Excel and reviewed outside of the suite. So the other view that is available from this report is that you can go directly to claim details and you can see all of the claims associated with those sepsis admissions only. So let's give this a second to get us back where we were, and we'll be able to look at our sepsis admissions specifically. Sorry, give me 1 second and we will refresh this. There you go. Okay. So if we wanted to look at our sepsis specifically, we can go to, if we click on our sepsis, we'll see claims details, and that will show us only our, only the claims for sepsis. If we click on that claim details right there. Okay. So now let's jump into our emergency room utilization report. The next 4 reports I'm going to show you are identical in form and function. So they were designed to have the same metrics with the same presentation so that once you get familiar with one of them, you're able to use all of them much more seamlessly. So our emergency room utilization report is focusing on emergency care, but it's providing it on 2 different metrics, ER, emergent ER, and non-emergent ER. Non-emergent ER is defined using a NYU definition of an emergency room visit that was deemed to be non-emergent based on the primary diagnosis. We have the definition here on several of our reports. You'll see this little blue eye indicator. Please click on that to get more information about the measure that's being displayed. So for these reports, we have our monthly trend. I'm looking at my NED rate. I can also toggle this to look at ER count if I want to look at the actual raw counts. Please be mindful of looking at raw counts when you're looking against the comparison group because your counts will be significantly off. So we find that looking at the rate is a far more apples to apples way to view your utilization. So we are looking at the non-emergent rate. So out of all of the emergency room visits for this population, what % have been deemed non-emergent, as opposed to the comparison group, which is being used as Medicare here. So we have our trend line for all of the months indicated in our slider. And then we have an aggregate evaluation of our NED rate by fiscal year. So we have our panel in blue and our Medicare in yellow and orange. We also have the number of our NED and ER emergent visits by hospital. So this first hospital has 16,000 ER visits with the split of emergent and non. We also have it broken down by primary diagnosis. And then we get into beneficiary level information. So we're looking at the beneficiaries by the count of the NED visits. So for example, this is interpreted as there being 800 beneficiaries that had at least 3 non-emergent visits over the date range that we're displaying. We also have by age band, we're looking at out of all of the emergency room visits, what % of those are emergent or non-emergent for that individual age band, and then a distribution by male, female for the same NED, non-NED rate. Everything here is dynamic. If I go ahead and click on my 810, everything will update here to only reflect those 810 beneficiaries. And similar to our acute care utilization report, there are hoverovers in all of these data elements. There you go. There's hoverover in all of these data elements where you can access the beneficiary details for those 810, or for the emergent 800 out of the 810 beneficiaries, the 31 to 41-year-olds who had an emergent ER. So you can get to the drill throughs that way. So jumping into our next one, we have our plan all-cause readmission, which is using a plan all-cause readmission rate. So it is looking at unplanned readmissions within 30 days of an index admission. We have the definition displayed on the top of this report as well. And you'll notice that this report looks exactly like the ER, but we're focusing just on readmissions instead. And I'm going to give this just 1 second to refresh. There you go. So the metric on the top is you're looking at PCR rate, or you can look at your count of readmissions. And you'll see that the flow of the report is the same with our fiscal year, our distribution by hospital, primary diagnosis, and then beneficiary details. Next, we have our PQI utilization report. This is focusing on avoidable hospital and ED utilization. So you'll see at the top that we are, this is just hospital utilization. So you're able to look at your PQI. You can look at them overall, but you can also look at them overall by using your composite rate. But we also enable a PQI selection, so you can look at each individual PQI if you would like to. The metric for the line is your per K, so it's going to be your PQI admissions per K or the individual count for your comparison group. Again, your Medicare Medicaid comparison is here. If you want to make it more apples to apples, you can filter from your global filter to only look at your Medicare or Medicaid population with that comparison group. And again, we have the same report layout. So the last utilization report kind of within this series is focusing on follow-up after inpatient admission. So we are looking at follow-up following an inpatient or an ED utilization. So this is physician follow-up, and this is within 7 to 14 days. So what we're quantifying here is that if you have a patient on your panel that was discharged from the hospital or had an emergency room visit, NED or non-NED, or did they have follow-up in the claims from a physician? And you can look at it as either utilization from ER or utilization from an inpatient setting. So we can see our trend of our overall follow-up rate. We can look at our distribution from the hospital. This one is slightly different because this is just showing us our overall follow-up rate or not follow-up rate, but looking at also by diagnosis and other demographics. So for example, if I wanted to take a look at people that had follow-up or did not have follow-up, I want to look at my 1,123 beneficiaries from this facility. And I go ahead and click on that. I can get to my beneficiary details. And I want to show you something that's additional functionality. This additional functionality is available in all the reports, but I'll highlight it here. So if I'm interested in everybody that has been discharged from this facility and did not receive follow-up from a physician, I now have my beneficiary list of my 805 people. If I want to keep that list and start looking at the utilization for those people, I can again create a roster from this view. So this is the customized view based on the utilization from the report I selected. I can now say that this is no follow-up and give more details based on the selection, and I can create my roster from here. I will then have a new roster that I can apply anywhere else in the reporting suite. So this functionality to create a roster can be made from any beneficiary detail view anywhere in the reporting suite, even if you already have a roster applied. So what's really unique about this reporting suite is that you're able to not only load a panel for patients you want, but you can filter it to a payer population you want, and then apply clinical and demographic characteristics that you want, but then based on specific utilization that you're seeing in the report, narrow it down even more. So it becomes a really helpful kind of care management tool to really drill down to see the beneficiaries you're looking for with the specific utilization patterns that you're looking for. Okay. So that is the majority of the specific utilization metric reports. Let's walk you through the rest. We're going to start with our PM trend report. For any attendees on the line who are familiar with the MDPCP reporting suite or are participating in that program, this report should look pretty familiar to you. It's the same form and function as what you're used to. But for those who have not seen this before, this is looking at all of the claims by care setting and quantifying it, turning it into a per member per month beneficiary payment rate. There's a very important caveat I want to make sure everyone is clear on this one, is that as Grace introduced, we are looking at Medicare fee-for-service, Medicaid fee-for-service, and Medicaid encounters, so Medicaid managed care. Due to the lack of valid or complete payment rates in the encounters. So the Medicaid managed care population, the encounters that we are looking at do not have valid payment rates. So we are excluding those from this report for now. That is something that we are working to address, and we'll be rolling that out over the next few months. But this report you'll see is limited to only Medicare fee-for-service and Medicaid fee-for-service beneficiaries. So please keep that in mind, just to make sure you know the audience or the population being viewed here. So we still have the same slider view. We still have the same comparison dropdown. We are breaking all of our claims down by care setting. We are aggregating it by part A and B as well, and showing you trend lines over time for each of the care settings individually. We then have provider level detail of what's driving that per member per month. If you do not select anything, this is going to show you across all of your different care settings what's driving your PMPM cost. But if I want to focus more on my outpatient, for example, I have 139 per member per month payment for my outpatient population in my panel. I click on that. I'm able to isolate that trend line, and I'm able to focus on my outpatient providers specifically to see how many beneficiaries have touched those providers, total claim, and average claim payments. This is a high-level report. This does not contain beneficiary drill-through, but gives you a sense of where you are in your PMPM trends over time. Okay, so let's move along and cover these last three suites, and then we'll make sure we have ample time for questions. Next is the Health Equity by Demographics report. And this report is designed to focus on health equities, looking at disparities in healthcare utilization across populations based on demographic characteristics. So we are going to be looking at a line chart that is allowing us to pick a metric and allowing us a demographic characteristic to then focus on. So I'm actually going to pick IP admissions per K. My x-axis is my time, my y-axis is my IP admissions per K, and my lines are representing age groups. So you're able to take any of these measures on the right side here and view them in the chart, and you're able to show it by various chart lines. So I could do age, gender, race, county, region. I have right now it viewed by age. If I find that this age line of my 81 and over is kind of messing up my scale or distracting my view of what I want to do, you have the opportunity to filter that out. I could just go ahead and remove my 81 and over. My whole chart will reset, rescale, and give me a different view. If you would like to look at two metrics at a time, you also have your separate charts, which means that I'm able to look at age as well as look at a different measure. So I'm going to say I want to look at age and I want to look at dual status. So I want to look at my IP admissions per K, my rated number of admissions per 1,000 beneficiaries, by age and for those that have dual Medicare Medicaid coverage versus those who do not. So it's a way that you can make it customized. Again, you can exclude or include any of the categories themselves to compare metrics in a way that makes most sense for your question. At the bottom, we're getting into what we call a disparity index. So what this effectively means is that by looking at the measure that was calculated, how does that compare to the other demographic categories? So in IP admissions, looking at age group, we have a default category. You'll see an asterisk here that our base population is our 61 to 70-year-olds, and they have a disparity index of 1.0. The way disparity is calculated is the measure of interest for the population of interest divided by the base population. So for our under 18, it's 50. So we have 50 admissions per 1,000. Divided by the 182 admissions per 1,000 is a disparity index of 0.28. Age is probably not the best way to be looking at this. We could, I think if we were to pull in race, we would see some different disparities, or those that might actually indicate a gap in care, that you're able to then see the disparity index and highlight really clearly, is there a population that has higher utilization by looking at this demographic category? At the bottom, it's additional statistics where we're taking those race categories that I just switched to. We're also introducing chronic conditions. So we're using chronic conditions as a possible reason for the difference in utilization, and just presenting statistics on the count of beneficiaries and the percent of beneficiaries by that demographic category selected and by chronic condition. Okay. So jumping into our maternal health, this is certainly a Medicaid specific or a more Medicaid focused reporting suite. This contains 4 different dashboards, and the purpose here is to isolate the maternal care for completed pregnancies or ongoing pregnancies within your population. So we have our maternal demographics report. We're focusing on just the number of again, by completed or by ongoing pregnancies, the number of women with completed or ongoing pregnancies and their chronic condition distribution, and a geographic distribution of where they are. And then we're able to focus on the delivery outcomes for those deliveries, looking at the number of births by cesarean or vaginal delivery, the cost associated with those, the gestational age at the time of delivery, birth status, and the distribution by hospital. Please be mindful that when you're looking at this population, you want to likely filter it down to your Medicaid only to make it possibly more meaningful. You can also filter for individual chronic conditions if you only want to look at your mothers with certain chronic conditions. We then have our maternal dashboard and our postpartum dashboard. These work the same way, and their focus is to identify gaps in care. So we're looking at the prevalence of recommended prenatal visits and seeing if our mothers are getting that care. So looking at gestational weeks, if the patient received the recommended prenatal visit, you can see that for that 52% of the population between gestational weeks 28 and 31 did not receive follow-up care. All of these do contain drill-through information that you're able to access the individual mother's names and their information, and use that to target advanced follow-up or otherwise tracking within your organization. And it's the cost of service and just the time of the first prenatal visit. Our postpartum operates the same way. Instead of looking at prenatal care, we're looking at when they received their first postpartum care. So this is just much more helpful to look at trends to see if your population are getting that postpartum care, and if not, introduce interventions or otherwise to make sure that those gaps don't continue in the future. All right, I'm going to take just another few minutes and focus on our CMS core set measures, and then we'll open it up for questions. Our CMS core set measure dashboard has a selection of just 6 core set measures that the team thought would be helpful to start with. It's just a launching point. As you may be aware, there's hundreds of core set measures that can be focused on here. But there's 7 here that we're starting with. Some are rate-based, which are the top ones. These are count-based. We are looking at the algorithm for the CMS core set measure and applying it for our Medicare and our Medicaid population. The measures that we have focused on, 2 of them, this first one and this third one, are based on substance abuse or alcohol dependence. You need to be very careful while using these reports because our Medicare claims, our CCLF data, do not have claims associated with substance abuse or alcohol dependence. Those have already been redacted by CMS prior to them getting to us for processing. So if you use this, please make sure to use it on your Medicaid population because your Medicare population would produce 0 results here. So you won't really find any beneficiaries that meet that measure, and you won't have a comparison group either. We have hospitalization for mental illness, and then we have several count-based measures here. So I'm going to focus on the mental illness, just so we have a comparison group we look at. All of the rate-based measures have the same design. You have your sliders on the top. You have your trend line of your utilization for the population that had follow-up after a hospitalization for mental illness compared to the rate for the Medicaid population. We're then looking at the discrepancy between the rate of the panel and the rate for Medicaid, and looking at the primary diagnosis for those hospitalizations and the gender age distribution for those receiving follow-up and those not receiving follow-up. Yep. And then we can also select one count-based measure to just give us a look, because that looks a little bit different as well. I'm going to select our ambulatory care, our emergency department visit. And this is focusing on the CMS core set definition for emergency room. So this is admissions to an institution among health home beneficiaries for 18 and over. So we're looking at our population by count. We then have our ER diagnosis, count of admission, count of visits and payments associated with those, the hospital distribution, the list of patients, as well as the distribution by age and gender. All right, so that was a quick run through of everything we have in this reporting suite. I'm actually going to turn it over now to Grace or to Kate. If you want to walk us through any outstanding questions that need to be addressed, I'll be happy to answer them.
Thanks so much, Audrey. And before we get to questions, I actually want to go ahead and launch a poll. Thank you, Kevin, for doing that. So as Grace mentioned in the beginning, we are looking to get feedback on the future of this reporting suite and what reports or data you'd like to see included in future iterations. We've put up a poll. If you'd like to put any ideas or suggestions you have in the chat, feel free, or excuse me, in the poll, and then I will continue to take questions in the chat. And Audrey, give me just a minute to see if there are any questions which should be answered by you directly. Okay. I'll take you through a couple of the questions that we got, Audrey, and if there's any that you'd like to elaborate on, feel free. We received a question, will a future state allow us to do side-by-side comparison of the two populations? I think this question came in before you had kind of demonstrated that a lot of the reports do offer side-by-side comparison of the two populations. Is there anything you want to add to that, Audrey?
No, I think, but the two populations, meaning the panel and the comparison group.
Yeah, I think the person did not elaborate, but if you want to say kind of what folks can compare, that would be helpful.
Yeah, so throughout the reporting suite, you might have seen that all of the reports have custom comparison groups of the Medicare or the Medicaid population. So please keep your eye on those blue lines and those orange lines. That'll always help you understand how your performance is measuring or your utilization is measuring against that comparison. And just be mindful that you're not applying your global filter of Medicaid with your comparison of Medicare. If you keep those two in sync, the comparison should be really helpful.
Thank you. Somebody asked, will there be a population for dementia? And I did call out that there is an Alzheimer's disease filter in the measures list. Anything else you want to mention there, Audrey?
We'd love to hear populations of interest to you. So we use the CMS chronic condition warehouse flags for those chronic conditions. There are additional ones that we have not included. So if there are ones that are missing you want to include, just let us know. We can add it into our queue. I think there are several related to mental health. So that just comes to mind now, that we can certainly work to get in.
Thank you. We've got a few questions here about panels. So in reference to the question from Amone, Kate, is the panel referring to the health center panel or payer panel? Just want to mention that some users may have access to more than one panel. Panels, again, are patient lists that are provided to CRISP either by a health center, it could be a payer, it could be another kind of program or group that is providing a list of patients they have a treatment relationship with. So depending on your role and your access within CRS, you may have more than one panel that you can view. If you have questions or need help with sort of getting access to the right panels for you, you can email report-support@crisphealth.org and we can see kind of what you currently have access to and what we can provide. Okay. I think you answered this, but just to reiterate, we got the question, is the comparison group your own patients or some statewide population?
It is the overall statewide population.
Thank
So
you.
you would be comparing your, for example, your Medicare fee-for-service population to the statewide Maryland Medicare fee-for-service.
Great. A question here from Cindy. Do the reports have the ability to filter out expired patients?
Yes. From the Population Navigator view, when you pull down the different column options, there is a column for date of death. So I would make sure that that date of death is exposed so you can see it and you can filter on no. And then from there, create your own roster that would be panel excluding deaths. And then you can use that throughout your report.
Okay, I think we had one more question that the user may have had to drop off, but a question about PQIs. Person said, I thought the AHRQ PQIs were for potentially preventable inpatient admissions. How is that being applied for ED?
Thank you. That was actually a misstatement. I jumped ahead in my mind to the following report. Our PQIs are looking only at inpatient admissions. So it is the AHRQ full PQI logic. We're applying them to inpatient admissions only, not to emergency rooms.
Great, thank you.
Kate, I do see a question of how NED and PQI differs.
Yes.
Oh, I see that you answered that. Okay.
Anything else to add though, Audrey?
They're different kind of stewards. So NED is focusing on non-emergent ED utilization. That is an NYU definition. That is a series of primary diagnoses that the NYU logic deems is just not emergent. You didn't need to go to an ER for. You could have gone to an urgent care or received some other path for care. Whereas the PQIs are focusing on inpatient admissions, and those are identified as preventable. So emergent and preventable are kind of different in this vein. One is you could have prevented the PQI from needing to happen, as opposed to the NED, which is this is not an emergency room visit. So they're kind of different on several veins. They are outlined in the user guide, and happy to answer any additional questions on that if it comes up.
Thanks. And a couple more questions coming through here. Is there a flag in the data that identifies a Medicare patient who may be attributed in the MDPCP program?
We do not currently have a flag for MDPCP. We do understand that several MDPCP practices have their own panel for the attributed population only. So if those panels are created with CRISP, you'd be able to look at your MDPCP specific population by doing it that way.
Thank you. And Leah asked, are you able to send the NED ICD-10 codes that were used?
The user guide does contain a link to the NYU website, and I believe it is in there. We'll make sure, or we'll otherwise get it to you.
Great. And Michelle asked, when will this be available for use? This report is available today. If you do not have access to CRISP reporting services at all, you can email support@crisphealth.org. If you already have access to CRISP reporting services and you just need help getting access to this reporting suite, you can send us an email, report-support@crisphealth.org, and we can help to get you set up. I don't see any additional questions coming through, but I'm happy to stay on for a few minutes in case folks have additional questions. Will the recording be sent out? Yes, we can send out the recording and the slides. I'll put the email in the chat. It is report-support@crisphealth.org.
Kate, I'm not sure I mentioned at the top of where the user guide is. When you log into your reporting suite, at the very top of the screen on the right side, you're going to see a help button, and that is going to give you access to the full user guide. You can download it, save it, refer to it. It contains screenshots for every report. It outlines all of the algorithms and the logic used for the reports. Also introduces all the functionality. So definitely, it's a little bit hefty. It's long, but we hope it's comprehensive. If you have any questions, I'd say start there. But definitely, please do not hesitate to reach out if you need more help using this or just want to help, want to understand how to make the best of it. We're always happy to help.
Wonderful. Thanks so much. If there's no further questions, I see folks are starting to drop off. I did put the email in the chat and it's on the slide. You can email report-support@crisphealth.org if we did not get to your question or if you need help getting access to the tool. Thank you all so much for attending today's webinar.